What is the conditioned stimulus? Have you ever wondered how certain sounds or smells can suddenly trigger intense feelings of fear or anxiety? This phenomenon is often explained through the concept of a conditioned stimulus. In psychology, particularly in the study of fear conditioning, a conditioned stimulus is a previously neutral stimulus that, after being repeatedly paired with an unconditioned stimulus, starts to evoke a conditioned response. This idea is rooted in classical conditioning, a learning process famously explored by Ivan Pavlov. To break it down, let's look at some basic concepts. An unconditioned stimulus is something that naturally triggers a response without any prior learning. For example, the smell of food can automatically cause salivation. The salivation in response to that smell is known as the unconditioned response. Now, the conditioned stimulus starts off as a neutral stimulus, meaning it does not initially elicit any response. However, when this neutral stimulus is paired with the unconditioned stimulus multiple times, it transforms into a conditioned stimulus. For instance, if a bell rings every time food is presented, eventually, the sound of the bell alone can trigger salivation. This learned response to the conditioned stimulus is called the conditioned response. When we consider the context of post-traumatic stress disorder, or PTSD, the concept of conditioned stimuli becomes particularly relevant. Traumatic experiences can act as unconditioned stimuli, naturally causing fear responses. Over time, other stimuli that were neutral can become conditioned stimuli if they are associated with those traumatic events. This means that even in the absence of the original threat, these conditioned stimuli can trigger fear responses, leading to symptoms like flashbacks or anxiety. Understanding conditioned stimuli is crucial for developing effective treatments for PTSD. Therapies such as exposure therapy involve gradually introducing individuals to these conditioned stimuli in a safe and controlled setting. This helps them learn to distinguish between safe and threatening situations, ultimately reducing the power of these stimuli in their daily lives. In conclusion, the conditioned stimulus is a vital element of classical conditioning and plays a significant role in how trauma affects individuals. By recognizing how neutral stimuli can become linked to traumatic experiences and elicit fear responses, healthcare professionals can create targeted strategies to assist individuals in their recovery journey. Always remember, if you or someone you know is struggling with trauma or PTSD, consulting a healthcare professional is an important step toward healing.